Let's talk about medication overuse headache. So medication overuse headache, the name explains what happens. It results from overuse of abortive headache medications. The most commonly implicated ones are butalbital, opioids, and acetaminophen. Medication overuse headache can frequently complicate other types of chronic daily headache, making it very difficult to treat. The most common implicated primary headache disorder is migraine. So the most common scenario is that a pre-existing headache disorder such as migraine gets treated with frequent use of abortive headache medications, and that eventually, a few months later, can develop into medication overuse headache. Interestingly, this only develops in people with previous headache history, and it's fairly common, affecting 1 to 2% of the population. So, for the clinical features, it does require a pre-existing headache disorder. You must also have, concurrently, the overuse of abortive headache medications for greater than 3 months. For simple analgesics, it requires 15 or more days per month of use. So simple analgesics include acetaminophen and NSAIDs. You can also have 10 or more days per month use of triptans, ergotamines, opioids, or a combination of the simple analgesics. Medication overuse headaches requires that the headache happens for 15 or more days of the month. The pain is fairly non-specific and it can mimic other headache disorders. For treatment, patient education is very important, and discontinuation of the acute headache medications. These interventions can result in greater than 50% improvement in headaches in 2/3 of patients at 6 months. The patient should be warned that there can be worsening of headache in the first few days to weeks upon discontinuation of acute headache medications, kind of a rebound effect. Naproxen has been used to bridge during this time. Preventative headache medication can be started as well, either on day 1 or after a few months, if the headache has not improved after discontinuing the acute headache medications. And the exact preventative headache medication to be started depends on the initial primary headache disorder that's being targeted. So the patient should be counseled that NSAIDs should be used less than 15 days a month, and other abortive headache medications less than 10 days a month to prevent the medication overuse headache from coming back. For prognosis, the relapse rate is 41% at 1 year. However, the relapse rate seems to be lower for people with primarily a migraine compared to a tension type headache in the beginning. Remission at 1 year and efficient initial drug withdrawal are predictors of long-term remission.